Thanks, Dr. Marie Crandall, for talking to OnSurge today. You are a public health researcher. You're a trauma surgeon, and you've published studies on various trauma mechanisms, falls, suicide, blunt trauma, motor vehicle accidents. You've also studied various victim populations, geriatric populations, pediatric populations, by gender, by language. And you also research trauma systems themselves, true?
That's right.
And you've also studied injuries from firearms. Please discuss the barriers to studying injuries from firearms as compared to other mechanisms of injury.
Well, I think pretty much everyone who's been paying attention to the news or John Oliver knows that the CDC has had a 20-year ban on funding firearm-related research. And in contrast, there's hundreds of millions of dollars that the CDC funds for motor vehicle collision research, falls, geriatric falls in particular. And all of those are really important mechanisms, but 30,000 plus people die every year due to firearms. And that's the equivalent of a jetliner slamming to the ground every single day with 100 people on it. There's no one on earth who would get into a plane if that were happening, and we would want to know why. But the equivalent of that is happening every year with firearm injuries for the past 40 years, and we're not empowered to study it. The NIH just released some funds about 2 years ago, a few $1 million to fund some research projects looking at gun violence. But it's a couple of R1s and federally funded research projects that are really going to go to seasoned investigators. And by contrast, there's hundreds of millions of dollars to study, let's say, HIV or pediatric neuroblastoma, which are all, again, worthy topics. But in terms of the number of people who die of this mechanism, a lot more kids die of both accidental and intentional firearm injuries than they do neuroblastoma.
Mm-hmm. And if we looked at another mechanism that we have studied, we look at motor vehicle injuries. Can you talk about how that research led to changes which reduce injuries?
Oh, absolutely. I feel like motor vehicle collisions and research in motor vehicle collisions have been a public health victory. So in the past 50 years, the case fatality rate for a crash has gone down by like 90%. So you can measure it by the absolute number of people dying in motor vehicle collisions, which is lower, even though the population has more than doubled in 50 years. Or you can look at it as per 100,000 people, and that has gone down significantly. Or you can look at it as per 100 million miles traveled. And there are more people, they're driving longer, having more cars, and driving further. And that has gone down by like 90%. And that has been due to improvements in road traffic engineering, car engineering, and especially seatbelt laws and DUI laws.
Mm-hmm. Mm-hmm. So when it comes to what we can and can't study, I've heard some senators say that a gun is not a disease, and therefore not the domain of the Center for Disease Control. How do you respond to that?
Well, I think it's kind of like saying that the virus, human immunodeficiency virus, is not a disease. It's not. It's a virus. It's a vector. And just like a gun is a vector or a hammer is a vector, if you want to hammer someone to death, they're vectors. But that doesn't mean that you shouldn't study them, because you have to have a mechanism of transmission, and that would be a person using that to then cause injury or disease in someone else. But I think it's disingenuous to say that it's a benign thing, because it's not. In other civilized first world countries that have gun restrictions or gun ownership restrictions, it's not that they're so much less violent than we are. The rates of interpersonal violence in the UK, in Europe, are the same as the US, but the almost all of the excess mortality with respect to homicides in the United States is completely attributable to firearms.
Mm-hmm. Now, if funding for research were more readily available, what would you like to see studied, or how would you design such a study?
Well, I think prevention is the hardest thing to study, but is certainly the most effective. So the efficacy of media campaigns, the efficacy of, let's say, gun locks, and we have shown in certain populations that works. So for pediatric firearm injuries, having gun locks, guns stored locked and unloaded does decrease suicides in the home for at-risk youth. So there are some things that we do know, but I think on a larger population basis, that could be much more persuasive. Also funding into the kinds of things that they did for cars, the car engineering equivalents for guns. So gun locks, things that are, you can use your fingerprint to turn on your phone. You might want to be able to use your fingerprint to turn on your gun. I'm thinking of also interpersonal violence, because guns are so readily accessible that it is the combination of impulsivity and lethality of means that really are devastating. So looking at interpersonal interventions, and this has been done on a population basis, the Cure Violence model, the Safe Streets replica model in Baltimore have shown that when you put somebody on the streets who is a credible messenger, who can find someone who's at risk to perpetrate and can maybe broker alternatives to perpetration by using a firearm, that fewer people die. And every time a life is saved is a possibility of someone contributing to society.
Indeed. So last thoughts on the study or the inability to study firearms injuries.
I think if you care about this topic, you need to realize that the U.S. needs sensible restrictions on guns. And a good first step are more restrictive licensing. And that would be for all states, federally mandated. Also, the high-capacity magazines. If with 1 or 2 or 10 pulls of the trigger you can kill 10, 20, 30 people, I think that's excessive. Certainly rifles, hunting rifles, are a part of American society. And I don't think anyone would say, let's go out and get everybody's 30-30s and 30-06s so no one can hunt. I don't think anyone would say that. But I'm also pretty sure that our founders, who had to muzzle load their bullets and pour in powder into their powder from their powder horns that would get wet and half the time not work, hence the idea of a musket, would have thought that perhaps we shouldn't be able to have a 100-bullet magazine readily accessible for non-military purposes or not necessarily military, but law enforcement purposes. I really think that sensible restrictions are reasonable. And we saw the Bureau of Alcohol, Tobacco, and Firearms found that during the time of the Brady Bill and also the assault weapons ban, that the proportion of interpersonal violence cases and also crimes committed with assault weapons decreased significantly over that 10-year period, and actually was sustained for several years after the sunset of those laws, but has crept back up.
I see. Thanks, Dr. Crandall. Talk to you again soon.
Thank you.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.